Respiratory rate refers to the number of breaths a person takes in 1 minute. An elevated respiratory rate is a sign that something is not right in the body and indicates that the body is trying to compensate for a change in its environment. The respiratory rate is controlled by the respiratory center in the brain, which is responsible for regulating the number of breaths taken per minute. When your cells are working harder, like when you are exercising or when you have a fever, they need more energy. Your body knows this and reacts by making you breathe faster and deeper, so you deliver more oxygen to your cells. An elevated respiratory rate is the first sign of distress. What is considered a normal respiratory rate varies with age. The respiratory rate is at its highest in infancy, where a respiratory rate of 60 breaths per minute is considered normal and decreases with age. A normal respiratory rate in adults is around 16 breaths per minute. However, if a person is seriously ill or injured, their respiratory rate may be more than double that. On the other hand, if a person is hypothermic or sedated due to alcohol or drugs, their respiratory rate may be less than half the normal rate. Other factors, such as high altitude, heat, and mental stress, can also affect breathing rates. Measuring a person's respiratory rate accurately can sometimes be difficult, but you can obtain a rough estimate by comparing their breathing to your own. It's important to remember that an elevated respiratory rate is an early but unspecific sign of sickness and is used together with other measurements to determine if a person is seriously ill.